As women age, various physiological changes occur that can impact overall hygiene, including changes in skin elasticity, hormonal levels, and the immune system. One frequently overlooked but medically significant issue is the type of clothing worn, particularly undergarments. Many older women unknowingly contribute to persistent vaginal or perineal odor simply by choosing underwear made from synthetic materials such as nylon, polyester, or spandex blends. While these fabrics are often marketed for their durability, sleek fit, and affordability, they can pose real health concerns, especially in the sensitive and high-moisture environment of the genital area. The human body, especially in the perineal region, relies on airflow to regulate temperature and moisture. Cotton, being a natural fiber, allows for this kind of breathability. It permits air circulation, absorbs excess moisture, and reduces the risk of fungal or bacterial overgrowth. In contrast, synthetic fabrics tend to trap heat and moisture against the skin. This creates a warm, damp, and often dark environment at conditions that are ideal for the proliferation of microorganisms. While some bacteria and yeast are naturally present in the vaginal area, an imbalance caused by heat and trapped sweat can lead to infections such as bacterial vaginosis or yeast infections, both of which can produce a strong, unpleasant odor. This issue is further compounded by age-related changes. As estrogen levels decline during and after menopause, the vaginal walls become thinner, less elastic, and less acidic. These changes alone already shift the balance of good and harmful bacteria. When this already sensitive environment is further stressed by synthetic fabrics that don't breathe, the risk of odor increases significantly. In fact, in clinical practice, it is not uncommon to hear from older female patients that they have noticed a persistent smell despite maintaining what they believe is good hygiene. Many are surprised to learn that their choice of underwear may be a contributing factor. Additionally, older adults may not sweat as much as younger individuals, leading some to assume they are at lower risk for moisture accumulation. However, this assumption can be misleading. Even low levels of perspiration, combined with natural vaginal secretions and urine leakage, a common concern with aging, can result in dampness. When moisture is held against the skin for extended periods due to non-breathable underwear, it can lead to irritation, inflammation, and eventually, odor. This is not a matter of poor hygiene but a mismatch between the clothing material and the body's needs at this stage of life. Infections are not the only concern. Skin breakdown is another issue that arises from constant dampness and lack of air circulation. Intertrogo, a form of skin inflammation occurring in warm, moist body folds, is more common in older individuals and can develop in the groin area. Once the skin barrier is compromised, it becomes even easier for bacteria and fungi to enter and cause further irritation and odor. Prevention is always better than treatment, especially in geriatric care where healing tends to be slower. One of the simplest and most effective preventive measures is recommending breathable, natural fiber underwear. Cotton underwear, in particular, helps keep the area dry and supports healthy skin integrity. Some manufacturers also offer underwear with a cotton gusset, a small cotton panel in the crotch, which is a better alternative than fully synthetic options. Moreover, it's important to consider how underwear fits. Tight-fitting synthetic underwear not only limits airflow but also causes friction. This can lead to chafing, especially in older women who may already have thinner, more fragile skin due to reduced collagen production. Repeated irritation from tight or ill-fitting underwear can cause microtears in the skin, which can then become entry points for bacteria. In cases where urinary incontinence is also present, a common occurrence in older women, these small skin injuries can quickly become problematic, leading to both odor and potential infections. It's worth noting that many older women may not be aware of the connection between their clothing choices and genital health. There's often an assumption that odor is inevitable with age, or that it results from poor hygiene or illness. As a senior health physician, I find that education in this area is both empowering and preventative. Explaining how synthetic fabrics affect the microenvironment of the genital area helps patients make informed choices that align better with their health needs. When counseling patients, I also stress the importance of avoiding overly fragranced hygiene products that are often used to mask odors. These can cause allergic reactions or further disrupt the natural bacterial balance. Instead, a shift towards supportive clothing choices like wearing loose, breathable cotton underwear and changing them daily can go a long way in reducing odor without the need for chemicals or medications. Ultimately, the goal is to promote comfort, dignity, and health as women age. Something as simple as choosing the right underwear fabric can play a substantial role in that equation. While it may seem like a small change, in the context of senior health, it's a significant and proactive step toward preventing complications and maintaining quality of life. For many older women, switching to breathable cotton undergarments can be a turning point in managing persistent odor and improving personal confidence. As with many aspects of health in later years, it's not about doing more, it's about doing things a bit differently, with better awareness of how the body changes over time. Not changing underwear daily is a surprisingly common habit among older women, yet it can have serious implications for hygiene, comfort, and overall health. Many women may assume that if there is no visible dirt or strong body odor, their undergarments are still clean and suitable to wear again. However, from a medical standpoint, this assumption is misleading and can contribute significantly to unpleasant smells in the vaginal and perineal area, often without the person realizing it. As a senior health doctor, I can confidently say that the simple act of changing underwear every day plays a critical role in preventing odor and infection, especially in the older adult population. As the body ages, several natural changes occur that affect skin, immunity, and the reproductive system. One important change is a decrease in estrogen, which alters the pH balance and bacterial flora in the vagina. This can make older women more susceptible to infections and imbalances. On top of that, thinner skin, reduced elasticity, and a weakened immune response make it harder for the body to protect itself against microbial invasions. If undergarments that have absorbed sweat, natural secretions, or even tiny amounts of urine are worn again without washing, bacteria and fungi can multiply rapidly. This not only increases the likelihood of odor but also raises the risk of rashes, irritation, and even urinary tract or vaginal infections. The perineal area is naturally warm and moist, conditions that favor bacterial growth. Even with low levels of perspiration, older women may experience vaginal discharge, slight incontinence, or sweating, particularly during warmer weather or physical activity. Once underwear absorbs these fluids, it becomes a breeding ground for microbes. When the same underwear is worn a second day without washing, those bacteria and yeasts continue to thrive and grow, which inevitably leads to a noticeable odor. Unfortunately, because this change happens gradually, many women become accustomed to it and may not even be aware that their scent has changed. Some older adults may also deal with mobility issues or fatigue, making laundry feel like a burdensome task. In those cases, rewearing undergarments may feel like a practical solution. However, the trade-off in terms of hygiene and health is rarely worth it. Medical professionals often see a rise in dermatological issues, skin breakdown, and urogenital infections in elderly patients who reuse clothing, especially underwear. These complications not only affect physical health but can also lead to emotional discomfort, embarrassment, and reduced self-confidence. Furthermore, many seniors may struggle with a diminished sense of smell, a condition known as presbyosmia. This can make it even more difficult for them to recognize when their clothing or body carries an odor. In turn, they may unknowingly go out in public with unpleasant smells that can impact social interactions and personal relationships. Caregivers or close family members may hesitate to bring up the subject, creating a cycle of unawareness that affects the person's dignity and well-being. There is also the issue of skin irritation. Dirty underwear may contain dried sweat, salts, dead skin cells, and residual traces of bodily fluids. These substances, once dried and re-exposed to the skin, can cause chafing, itching, and irritation, especially in women with sensitive or thinning skin. These skin changes often go unnoticed at first but can progress to more painful or serious dermatological conditions over time. Some patients believe that if they shower regularly, their underwear will stay clean. Unfortunately, personal hygiene and clothing hygiene are two different matters. Clean skin placed in unwashed underwear will still be exposed to yesterday's bacteria. The cycle of odor and irritation continues until the undergarment is properly washed or replaced. Therefore, changing underwear daily is just as important as bathing, brushing teeth, or other daily hygiene practices. In some cases, older women may also rely on panty liners to protect their underwear and feel they can reuse undergarments if the liner has been changed. While panty liners can provide a layer of protection, they are not a substitute for clean underwear. Liners may leak slightly or allow moisture to pass through, meaning the fabric still collects bacteria and other contaminants throughout the day. Even with liner use, it is still medically advisable to change both the liner and the underwear daily. To encourage this habit, especially among those with limited mobility or financial resources, I recommend owning a sufficient supply of comfortable, breathable underwear. Ideally, cotton is the best fabric for daily use because it allows for air circulation and moisture absorption. Keeping a small laundry routine or enlisting help from a caregiver to maintain clean undergarments can make a significant difference in long-term health outcomes. Ultimately, the small effort of changing into a clean pair of underwear each day is an act of self-care that goes far beyond cleanliness. It prevents odor, supports skin health, reduces the risk of infection, and helps maintain personal dignity and comfort. In my medical experience, this is one of the simplest and most effective hygiene habits that can make a measurable difference in the lives of older women, and one that many are grateful to learn once they understand its importance. Wearing tight-fitting pants or shapewear may seem like a harmless or even beneficial choice, especially for older women who want to appear slimmer, feel more supported, or keep warm. However, from a clinical perspective, this clothing habit can be a significant contributor to chronic vaginal or perineal odor, skin irritation, and even infections. Many older women do not realize that garments which restrict airflow to the pelvic region can silently disrupt the delicate balance of the skin and vaginal environment. Over time, this disruption leads to persistent odors that may go unnoticed by the individual but are apparent to others, often causing embarrassment and confusion. As a senior health physician, I often speak with older female patients who are unaware that their clothing choices are directly affecting their intimate health. One of the most common culprits is the long-term use of tight synthetic pants or constrictive shapewear. These garments create friction and reduce air circulation, particularly in the groin and buttocks area, where moisture and warmth naturally accumulate. These are the exact conditions under which odor-causing bacteria and yeast thrive. Aging itself brings about several changes that compound this issue. The skin becomes thinner and less elastic, sweat glands become less active, but the skin still produces some moisture, and the genitals still produce natural secretions. With menopause, the vaginal tissues also become more delicate due to decreased estrogen, increasing susceptibility to irritation. When tight clothing presses firmly against this sensitive skin for extended periods, it not only traps moisture but also promotes the breakdown of skin cells. The result is an accumulation of bacteria, potential inflammation, and odor, all without the woman necessarily feeling discomfort at first. Furthermore, restrictive clothing often leads to a condition known in dermatology as occlusion, a term describing how tight garments seal off the skin from air. This creates a microenvironment where sweat, heat, and bacteria become trapped, often leading to intertrachal, inflammatory skin conditions in skin folds, folliculitis, infected hair follicles, or yeast overgrowth. In the elderly population, these conditions can escalate quickly if not addressed, especially if the person is unaware of the source or does not see it as a problem. Tight pants and shapewear also tend to apply constant pressure to the lower abdomen and groin. For older women who experience mild urinary incontinence is something that is incredibly common. This pressure can cause even more leakage or make it harder to recognize when leakage occurs. If the undergarment or pants trap even a small amount of urine, it becomes absorbed into the fabric and held close to the body for hours. Urine, when exposed to air and bacteria, quickly starts to break down and release ammonia-like odors. This is one of the most common hidden sources of that smell some women mention during routine health assessments, often attributing it to aging, when in fact it is preventable with better clothing choices. Another important consideration is that older women may wear shapewear or tight pants without realizing that they no longer fit properly. As body composition changes with age, a loss of muscle tone, redistribution of fat, changes in hip and waist shape, clothing that once fit well may now press too tightly against delicate areas. Unfortunately, many older individuals are reluctant to discard clothing they've owned for years or feel unsure about shopping for new garments. This leads to a pattern of daily use of tight clothing that continually irritates the perineal area. From a medical point of view, comfort and ventilation should always take priority over appearance, especially when it comes to undergarments or anything that comes in direct contact with the genital area. I often recommend loose-fitting pants made of natural, breathable fabrics such as cotton or linen. For those who still prefer some form of body support, there are now modern shapewear options designed specifically for mature women that allow better airflow and are made with moisture-wicking, hypoallergenic materials. It's a matter of making thoughtful clothing choices that consider both comfort and hygiene. Wearing looser garments is not just about preventing odor, it also reduces friction, allows for healthy airflow, and gives the skin time to breathe, especially in warm weather or when a person is active. I also advise patients to avoid wearing tight clothing for extended periods such as all day and overnight. If support garments must be worn during the day, they should be removed at night to allow the body to recover. Giving the skin that break time significantly reduces the buildup of bacteria and prevents chronic irritation. In many cases, women feel they are making a healthy or body-positive choice by wearing firm-fitting clothes to maintain posture or shape. While these goals are understandable, they must be balanced with the biological realities of aging skin and mucosa. Wearing comfortable, breathable, and correctly sized clothing is not just a comfort issue, it's a healthcare issue. Helping older women understand that tight pants or shapewear may be silently contributing to odor and discomfort is a powerful way to restore confidence and improve daily quality of life. So, if an older woman notices persistent odor, irritation, or a sense of dampness, even with regular bathing, the solution might not be more hygiene products or more frequent washing. It could be as simple and profound as choosing looser, breathable clothing that respects how the body has changed with time. This is one of the most practical, cost-effective, and doctor-recommended steps for maintaining vaginal and perineal health in the senior years. Wearing panty liners or pads for too long is one of the most overlooked yet significant contributors to persistent odor and irritation in older women. Many seniors use these products daily to manage light urinary incontinence, vaginal discharge, or simply as a precautionary measure. While the use of liners and pads can be helpful in maintaining comfort and dryness, wearing them for extended periods without changing can actually create the opposite effect, causing increased moisture, bacterial growth, and noticeable odor. This often happens without the woman being fully aware, especially if there is no visible sign of leakage or discomfort. In my experience as a senior health doctor, I see many older women who use liners as part of their daily routine, much like brushing teeth or combing hair. Unfortunately, what is intended as a hygienic habit can backfire when those liners are left in place for too long. The perineal region, particularly in older age, is sensitive, warm, and prone to moisture buildup due to natural bodily secretions, minor leaks, or even perspiration. When a liner is saturated with moisture and continues to press against the skin for hours, it creates the perfect environment for bacteria and yeast to multiply. The result is a musty, sometimes sour odor that can linger, even after bathing. One of the primary reasons this happens more frequently in older adults is due to a reduced sensitivity to physical cues. As we age, the skin and nerves become less responsive, and some women may not feel the same dampness or discomfort that would prompt them to change a pad or liner sooner. In addition, many seniors may have a decreased sense of smell or presbyosmia, which further limits their awareness of odor. This combination often leads to long periods of pad use without changes, and even worse, Some may use the same panty liner throughout the day or overnight without realizing the implications. Another key issue lies in the materials used in many commercial panty liners. While they are marketed as breathable, most of them are made from synthetic, non-porous materials that trap heat and moisture against the skin. Prolonged exposure to these conditions can cause skin maceration, softening and breaking down of the skin due to prolonged wetness. This is especially concerning for older women who already have thinner, more fragile skin due to lower estrogen levels and reduced collagen. When the skin barrier is compromised, it becomes more vulnerable to irritation, inflammation, and infection. I often encounter patients who are surprised to learn that their use of panty liners may be contributing to the very discomfort or odor they're trying to prevent. They assume that because a liner is small and appears dry, it doesn't need to be changed. But in reality, the genital area is constantly exposed to minor moisture from vaginal secretions, sweat, or traces of urine. These fluids accumulate, even in small amounts, and interact with the body's natural flora. When held in close contact with the skin by a saturated liner, this can trigger the growth of odor-producing bacteria. An additional layer to this problem is that many women, in an effort to stay clean and fresh, may choose scented liners. These products often contain perfumes and chemical agents that can irritate the vulvar skin, especially when used over long periods. While the scent may temporarily mask odor, it does not eliminate the underlying cause, and it can worsen skin sensitivity, leading to burning, itching, or even allergic reactions. In many cases, the body's natural odor becomes more pronounced as a result of trying to cover it up artificially. From a medical standpoint, the best practice is to use unscented, breathable liners only when necessary and to change them every few hours, ideally every 3 to 4 hours during the day. If a woman is dealing with heavier incontinence or discharge, she may need to change them more frequently. Nighttime use should be minimized unless absolutely required, and in those cases, a product specifically designed for overnight protection should be used, with the understanding that it must be removed promptly in the morning. It's also worth noting that liners should not replace the importance of clean underwear. Sometimes women will rely on liners and feel that this allows them to wear the same underwear across multiple days. This habit compounds the problem, as even with the liner, the underwear fabric can absorb moisture and bacteria, contributing to odor. A clean pair of underwear should accompany the use of a new liner to ensure full hygiene. Education around these habits is crucial, especially because many older women are private or even embarrassed to discuss these issues. They may not feel comfortable asking a doctor about feminine odor or may think it's a natural part of aging. But odor is not something to be dismissed or endured. It's a signal from the body that something needs attention. When a woman understands that simple changes in her routine, like regularly changing her panty liner, can dramatically reduce discomfort and odor, it empowers her to take control of her personal care in a way that protects her health and dignity. In conclusion, panty liners and pads can be useful tools, but only when used properly. For older women, the key is to avoid prolonged wear, choose unscented, breathable options, and prioritize frequent changes throughout the day. This small adjustment can go a long way in supporting skin health, preventing infections, and eliminating persistent, unpleasant odors that often go unnoticed by the person experiencing them. It's a quiet but powerful step toward aging with comfort and confidence. Wearing synthetic underwear is a common yet problematic habit that contributes significantly to unwanted vaginal and perineal odor in older women. While synthetic fabrics like nylon, polyester, and spandex are often used because they are stretchy, inexpensive, and quick to dry, they pose real health challenges when worn in direct contact with the most delicate parts of the body. As a senior health physician, I often see the long-term effects of synthetic fabric use on older women's skin, hygiene, and confidence. And in many cases, women do not realize that their choice of underwear is directly linked to persistent odors and discomfort. The issue with synthetic underwear begins with breathability, or rather, the lack of it. These fabrics are non-porous, which means they trap heat and moisture between the fabric and the skin. In the genital area, This creates an ideal environment for bacteria and yeast to grow. Natural vaginal secretions, perspiration, and even microscopic traces of urine or fecal particles from the perineal region become trapped in the moist environment. Without airflow, the moisture doesn't evaporate, and instead sits against the skin for hours. As bacteria and fungi feed on this moisture, they release gases and waste products that result in a strong, often sour or musty odor. Older women are particularly susceptible to this problem due to the physiological changes that come with aging. After menopause, estrogen levels drop significantly, which causes the vaginal tissues to thin and become drier. The skin around the vulva also becomes more fragile and prone to irritation. When synthetic fabric presses against this vulnerable skin, it causes chafing, inflammation, and microscopic skin breakdown. These tiny abrasions may not always be felt immediately, but they are doorways for bacteria and fungi to enter and multiply, leading to infection and odor. Moreover, synthetic materials often hold onto oils, skin cells, and bacteria even after being washed. Unlike natural fibers like cotton, which allow for more thorough cleaning and drying, synthetic fabrics may retain a residue that continues to affect the skin with each wear. This residual buildup can interact with body heat to create an ongoing cycle of odor. Even if the underwear appears visually clean, many older women choose synthetic underwear because it's readily available, or because it has a smoother or more fashionable appearance. Some also choose it for added support, especially those with limited mobility who find stretchy materials easier to put on. However, health should always take priority over style, especially when it comes to garments that sit directly against the most sensitive part of the body. In cases where support or ease of dressing is needed, there are cotton blend alternatives that provide both comfort and breathability without sacrificing function. Another point of concern is the role of synthetic underwear in trapping heat. Older adults are often more sensitive to changes in body temperature and may wear synthetic undergarments thinking it will keep them warmer in cooler climates. In truth, while synthetic fabrics may retain body heat, they do so without allowing for ventilation. This leads to overheating and excessive sweating in the perineal area, which again encourages the growth of odor-producing bacteria and yeast. This is particularly problematic for women who are seated for long periods or who wear adult incontinence products in addition to synthetic underwear, compounding the issue of trapped moisture. I also want to highlight the danger of relying on scented products or perfumed detergents to mask the odors caused by synthetic fabric. This is a common response when women notice an increase in smell, and, unfortunately, it often makes matters worse. The combination of synthetic fabric and scented products increases the risk of vulvar dermatitis, a painful skin condition marked by redness, itching, and irritation. In the worst cases, I've seen chronic inflammation lead to lichen sclerosis, a condition that requires ongoing medical treatment. In a medical setting, one of the first recommendations I give to women experiencing chronic odor or discomfort down there is to switch to 100% cotton underwear. Cotton is breathable, absorbent, and gentle on sensitive skin. It allows air to circulate freely, helping to wick away moisture and keeping the area dry. This small change, when combined with regular hygiene and daily changing of underwear, often results in a significant reduction in odor and irritation within just a few days. For women with urinary leakage or heavier discharge, cotton underwear with an additional absorbent liner can provide both protection and ventilation without the disadvantages of synthetic material. I also advise patients to rotate their underwear frequently and not only changing daily, but also replacing older pairs every few months. Synthetic fabrics wear down more slowly and may appear usable longer, but over time they can become less elastic and trap more bacteria. Replacing old underwear and choosing natural materials is an investment in hygiene and overall health. In conclusion, wearing synthetic underwear may seem like a minor choice, but for older women, it can have far-reaching effects on personal comfort, odor, and infection risk. This is not simply a matter of aesthetics, it's a matter of skin health, dignity, and quality of life. Switching to breathable, Natural fabrics is a doctor-recommended step that is both simple and powerful. For any woman experiencing unpleasant odor without an obvious cause, evaluating the material of her undergarments is a wise and medically sound place to start.